educational purposes only. And if you would like to use any portion of this presentation for non-personal educational use, please contact the meeting host or presenter for express permission. And here is just a brief slide on today's agenda. We will go over the Project Echo series overview. I'll give you an introduction to today's speaker. We will do the case study, and then we will have time at the end for a question and answer forum. And so a little bit just about Project Echo. So the Rutgers Cancer Institute became a Project Echo hub in 2021. And Project Echo is a movement to demonopolize knowledge and amplify local capacity to provide best practice care for underserved people all over the world. The ECHO model is committed to addressing the needs of the most vulnerable populations by equipping communities with the right knowledge at the right place at the right time. And this is done by using technology to leverage scarce resources, sharing best practices to reduce disparities, applying case-based learning to master complexity, and evaluating and monitoring outcomes. And if you'd like any more information on Project Echo, you can always visit their website down on the right-hand corner of the screen. And so I'm just going to give you a quick introduction for our speaker today. So we actually have Dr. Karen D'Alonzo, who will be giving a session today on cancer caregiving burnout. And so before I turn it over to her, we're going to put up our pre-test poll. Dr. D'Alonzo, would you like to read through those questions for the poll?
Sure. So we have 3 questions here. The first one, these are all true or false. The first one says caregiving has both physical and emotional components. True or false? The second one, second question is caregiving is only a short-term responsibility. And that's true or false as well. And the third question is caregiving burnout can sometimes result in behavioral issues or substance abuse. True or false?
Thank you, Dr. D'Alonzo. We'll give everyone a few minutes to do that. And while they're answering the polls, I will stop sharing so that I can turn it over to you.
Okay.
Karen, you're good to go when you're ready.
Okay. Okay, so good morning, everybody. I got to move all these faces here, including my own. My name is Dr. Karen D'Alonzo, and I'm an associate professor in the School of Nursing here at Rutgers. I have been at Rutgers for almost 22 years now, but prior to that, I worked as a public health nurse. A good chunk of my time between my initial nursing education and the time that I went back to graduate school was spent as public health nurse. And it was here that I first encountered caregiving issues, especially in the context of hospice care to cancer patients. So in the next half hour or so, I'll talk about what we know about the topic of cancer caregiver burnout. And as healthcare providers, you're likely to see these behaviors in your patients and in their caregivers, often their family members. So this presentation will help you to prevent, identify, and address caregiver burnout issues. So almost all of us at one point in our lives will function as a caregiver, and that's particularly true if we are women. Caregivers can be spouses, partners, adult children, parents, other relatives, friends, even neighbors can serve as caregivers. And the level of commitment as a caregiver can depend upon the amount of time needed, the age and ability of the patient, the disease trajectory, and the presence of other caregiver obligations. So one of the questions that we had in the true or false talked about, it's a short-term obligation. It may be a short-term obligation. On the other hand, it can be quite long. And that is one of the things that makes this frustrating, both for the patient and for the caregiver sometimes, is that we just don't know how long this is going to go on. And if the level of commitment, the level of effort that the caregiver needs to give will change over time, it will likely only become more intensive. And it is when these long-term stressors of caregiving lead to physical and emotional exhaustion that caregivers may suffer from what we refer to as caregiver burnout, also called compassion fatigue. And you will see there's a number of features of cancer caregiving that make caregivers even more prone to the development of burnout than, say, other types of illnesses. And we'll talk about them. So caregiving often has both physical and emotional components, and that was another true false question. And you can see on this little table here that there's a list on the left-hand side of some of the basic physical care that goes on. The caregiver needs to be present for doctor's appointments, often prepares meals, does housework such as cleaning and laundry, does grocery shopping, assists with physical therapy, and provides personal care such as bathing to the patient. The caregiver is also responsible, though, for meeting emotional needs, and these can be as challenging or even more so than the physical ones, in terms of needing to encourage a positive outlook, validating feelings of fear or uncertainty for the patient, lifting spirits after a hard day, maintaining daily activities with modifications. Some days you may have to change what you do a little bit because the patient isn't up to it. Connecting the loved one with outside support. And we'll talk a little bit about that later because that's going to be really important for the patient, but also for the caregiver. And then extending patience in difficult circumstances. And that's maybe one of the most difficult things that caregivers talk about. These are just a partial list of the potential physical and emotional needs. Caregivers often become involved in nutritional support, provision for safety, pain management, financial issues, all different kinds of things that are quite time consuming. So who's at risk for caregiver burnout? Basically, this can happen to anyone, but I think there are some particular factors that kind of set caregivers up for this sort of thing. First of all, caregiving that involves a high level of physical exertion. And cancer patients in particular may require high levels of physical care, turning and lifting and ambulating. And particularly if the caregiver is older or is maybe kind of out of shape, has physical needs of their own, these activities can actually result in injury of the caregiver. I mean, we see that lots of times, people hurting their back, lifting someone. So it's important that the caregiver learn about proper body mechanics so that they can do this safely and they don't risk hurting themselves and the patient as well. A patient that has, or a recipient of care who has severe behavioral problems. And by that, we mean it could be lots of things. It could mean insomnia. It can mean mood swings. It can mean confusion or combative behaviors. Those kinds of things are hard to deal with. And that increases the likelihood of caregiver burnout. As you can see from the little cartoon there, caregivers who have poor or neglected self-care, they're more likely to be at risk for burnout if they're not taking care of themselves. Socioeconomic issues, even with the caregiver or the patient or both. You know, if there is a need for equipment in the house or for certain types of treatments or whatever, and there are financial issues, that makes it even harder to get some of the things that you need to get done. Spouse caregivers. Spouse caregivers have some interesting challenges because in many cases they're on duty, as we sort of say, all the time. You know, they're up all night with patients when people wake up. And their time, unless they've got a structure of other people coming in and giving them a break at particular times, the spouse caregiver is there all the time, and they're constantly faced with whatever is going on. The other thing that spouses have, that if we think about it, this is difficult to watch someone you love deteriorate, particularly when you look at older people that have been married a long time. And it's difficult to watch somebody, you know, lose physical and perhaps emotional stability and really to watch them die. It's not easy to do. Long-term caregiving. Long-term caregiving is a big strain, because most people, I think, don't go into being a caregiver with the idea that they're going to be doing this for 5 or 10 or 15 years. And yet sometimes that happens. Particularly with cancer care, the trajectory of cancer has really changed a lot in the past few decades. So patients with cancer are living longer, sometimes with more complex treatment regimes, and these regimes require extended periods of caregiving. So, you know, many times what you start doing over time, you wind up, the treatment gets more and more complex and more time consuming. And this can be tough too. A lack of a support system. This is an obvious issue. I have a little story about this, particularly during the pandemic. This was an issue for lots of people who are caregivers. I have a colleague who actually was a former PhD student of mine, and she now teaches in another school in a nursing program. And she is in her early 60s and has had 2 parents who were in their mid to late 90s. Her mother had had a series of small strokes and had fractured her hip at one point. So she had some issues, but her dad was in pretty good shape. I mean, he was 97 and he was still playing golf once a week. And, you know, he was a real active guy, and he was her primary caregiver. So of course, during the pandemic, you know, the mother had been in the hospital prior to with one of these small strokes, and they really needed some additional help at home. The husband wasn't able to do everything for his wife, and so they brought in a home health aide. And within a very short period of time, both of her parents contracted COVID, and both of them died. And the father died first, which was really kind of a surprise because he was so healthy. And then within a couple of months later, the mother died. So, you know, this can be really tough when you have a situation like that, where you hesitate to want to bring people into the home because of illness reasons, because of financial reasons. Maybe you can't support it. Maybe you feel like the patient isn't going to get along with having an outsider here. But this lack of support is a big issue. The last one of these, and this was also a questionnaire, a question on this morning, has to do with substance abuse. And this is particularly true for people that have a history of substance abuse. They're at higher risk of relapsing into these kinds of issues, especially when narcotics and other psychotropic drugs are available in the house. So burnout doesn't always happen right away, and usually it doesn't, but it often begins when caregivers neglect the effects of caring on their own health. And these are all the symptoms that we associate with this emotional overload or symptoms of burnout, prolonged feelings of sadness, helplessness, or hopelessness, feeling tired even after getting plenty of sleep. So, if you are the primary caregiver, but you've got some help, say on certain nights of the week, if 1 or 2 nights of getting a good sleep don't really help you to feel well rested, then this is potentially a symptom of burnout. When people lose interest in doing things, especially things that you typically enjoy, that's a symptom of an issue too that needs to be attended to. Neglecting basic self-care, when people aren't attending to their physical needs, are not getting bathed or showered. They look really messy. These kinds of things are clues. Trouble concentrating. This is the kind of situation where the person will tell you, I read 2 pages of a book, and then I sat there and I couldn't remember anything I read. When they mention difficulties with concentrating like that, this is a possibility of, often we associate that with depression, but it's an element of burnout as well. Chronic feelings of anxiety and difficulty relaxing. So even when things you should be able to relax, and maybe the patient is asleep, maybe you've got some help in there with you and you ought to be able to take some time to yourself, but you can't relax. Impatience with the person you're caring for. This is a big one. I just got finished reading a novel, and some of you may have heard of this. I think it came out last year. It's called Motherload. And it's a story about a woman who cared for her elderly mother. And she was in her 60s, I guess, early 60s when it started. And her mother was about 97, something like that, 96. And she really expected she was going to go and live with her for like a year. And this was a woman who was difficult to get along with. She complained about everything that the daughter did, particularly her cooking. And the more the woman tried to cook and cook exactly what her mother would want, the more her mother complained about it. And what happened was, to make a very long story short, they would snap at each other a lot. And this went on for almost 6 years. The woman was 100 and closing in on her 102nd birthday when she passed away. So this book is full of these really contentious discussions between the woman and her mother. And when you think about it, it makes it difficult. Her mother was a widow, and this woman was divorced. So they were used to living as, by themselves. They were used to making their own decisions and not having to ask somebody, what do you want for dinner every night? And if they didn't want to eat, they didn't have to eat, that kind of thing. And when you think about, all the dynamics that happen with two adults, and in time, they added people to this whole care team. And eventually what they had to do was put her in hospice care in a nursing home. And she was in there for a while. And it really did help some things. There were other things that didn't help as much. But, these are some issues that we need to think about. Also, changes in appetite or sleeping patterns. Either you're not getting enough, you're eating too much, or you're not eating enough, or you're sleeping too much or not sleeping enough. So those kinds of things often are symptoms of burnout. So how do we prevent all this kind of stuff? Well, there are a lot of techniques that we can use, and and you'll see in a couple of slides, I have some links to things. These came from the Cancer Caregiver Guide. which really has some excellent suggestions. And they're sometimes very detailed things that caregivers have suggested. So I'll mention a few of these things. Since much of the cancer journey can seem out of control, it is helpful to focus on areas that you can control. And these often include preparing for certain situations in advance. And so for the first few of these, stock up on household items and medical supplies in the home. This is really good to kind of help organize yourself so that you don't get to a situation where it's 2 o'clock in the morning and you need a medication and you don't have it, or there are things that you need to do and don't have the supplies. Anymore, sometimes older people forget that anymore, you can get pretty much anything delivered to your house. And if you keep a list and need to stock up on those things, and get somebody to deliver them, that's ideal. Same thing with medical supplies or prescriptions or any of that stuff. Trying to keep a list and get them ordered before you're totally out of them. As a caregiver, it's helpful to become knowledgeable about the recipient's condition. What kind of illness is going on here, and where is this going to go? There's so much information on the internet now, and a lot of it, while some of it you have to be careful of, a lot of it comes from very reputable sources, and I'll give you a whole bunch of links here to look at those. Also, be prepared with a list of questions when you go for doctor's visits, when you see the doctor or any other healthcare provider. Ask them questions that they're concerned about, and try to have a good rapport with the provider so that they understand the kind of caregiver that this patient has. Keep a list of emergency contacts and keep a bag packed for the hospital. Stick it away someplace. Doesn't have to be out where you can see it, but that way, if something happens and the patient is admitted, that you've got just basic kind of supplies that the person would need to get by in the hospital. Any of you that have ever worked in a hospital, where it's like when a patient is admitted and they left their eyeglasses at home, or their hearing aid at home, or their dentures at home, or these kinds of things that are really important for older folks. Keep the patient involved as much as possible in their own care. I would never take over things for people that they can do themselves. If you have a patient who has diabetes and routinely gives themselves their own insulin, there's no reason that you have to take that over if they're capable of doing it. You might want to watch and make sure they can read the markings on the syringe and all that kind of stuff, and they're drawing up the insulin appropriately and everything. But don't step in and do things that the patient can do for himself or herself. Probably the most important thing we have on this whole presentation: ask for help when you need it and accept it when offered. That's super, super important. I tell patients, no one expects you to do this all by yourself. And sometimes, I often refer to that as permission giving, because sometimes caregivers believe that this is my job. She's my mother. He's my dad. I have to do all this. You're doing plenty, and if you need additional help, it's okay to ask for it. If you do ask for it and then things don't go right, or you decide, we don't really need it, you can always explain to the person, listen, things are going pretty well right now, but can I call you if we run into a problem again? So those are some ways to get around sometimes when you're not really sure you need help. And when people offer to do things for you, take them up on it. Even if it's little things, it can often make a big difference. Identify ways to take care of yourself and attend to your own medical needs. This is a very compelling statistic, and you'll see it in the TED Talk that we're going to look at in a minute. 30% of caregivers die before their loved ones do, and many more will become sicker than the ones they care for, eventually needing a caregiver of their own. That's not something that as healthcare professionals we think about a lot, but it's very true. And particularly if you have, an elderly couple or whatever, as good as that other person may be, we need to be concerned about their medical needs. When I worked in public health, we saw lots of situations where the person's caregiver would become very sick and sometimes pass away within a week or two after the patient did. So, this is really important. And then the other thing you have on top of that is that, if something happens to the caregiver, they're going to need someone else to then take care of the patient. Support groups can also be very important here. And I have a little picture at the bottom because a lot of these support groups are online now. So you don't even have to leave your house. If you have access to a computer or even your cell phone, you can join a support group for caregivers and really reap the benefits of what they can offer you. This is an analogy that we use a lot for self-care. We tell people to put the oxygen, just like on the airplane, put the oxygen mask on your face first so that then you can take care of the person that you're caring for, whether it's a child or, a handicapped person or an older person. And I think the take-home message here is it doesn't take long for you to take care of yourself so that you can take care of someone else. When you think about that process, how long does it take to put the oxygen mask on? Hardly any time at all. And so we need to think about that, sometimes look out for yourself first, be a little selfish. That's the way you think about it so that you can take care of other people. And these are some caregiver resources. All these links will take you to different types of resources for patients and then specifically for caregivers. The American Cancer Society Caregiver Resource Guide, the Cancer Hope Network, NCSS Cancer Policy and Advocacy Team, My Cancer Haven. The American Cancer Society also has the Cancer Caregiver Guide, which is really, really good. Some of you may not know this, but in New Jersey, we have a program called the JACC, the Jersey Assistance for Community Caregiving Program. And they're not the only insurance coverage that exists for this, but particularly with this and with Medicaid, the family member may be able to receive payment for providing caregiving services in the home or that are comparable to what you would pay a home health aide in the home. And this can be a huge help. I know we had a staff member in our department that utilized this kind of service with her mother. Her mother didn't speak English all that well, and they did not want to put her in a nursing home. She had been in one and didn't have a real pleasant experience. So there was 3 daughters in the family, and they took turns, and they were paid for their work as a caregiver in the home, and it worked out pretty well. They had her home probably for about 18 months, but eventually she passed away, and I think everybody felt this was a much better alternative than other things. The American Cancer Society has a ton of caregiver videos. And they start with very basic things like how to turn somebody in bed, how to give somebody a bath, all kinds of things that, sometimes people are just not aware of how to do these kinds of things. They can be a big source of help for caregivers. This Cancer Care is a national organization that has a lot of information to help people manage the challenges of cancer. And then NCI, which is the division of National Institutes of Health that deals with cancer care, has this site that focuses on specifically on caregiver needs when someone you love is being treated for cancer. So these are all particular kinds of resources that you might want to take a look at. And, you know, all of these websites are full of different kinds of ideas. So we're gonna look at a case study. First of all, does anybody have any questions before we start the case study? We'll have lots of time for questions and answers.
I didn't see any questions come in that would pertain specifically to the presentation, although someone did comment that the Rosalind Carter Institute for Caregiving is also a good resource for support
okay.
materials.
Very good. Thank you. Thank you. Yeah, thank you, Bonnie. That's great. So we're going to look at a brief video. This is actually a TED Talk, and it's about 10 minutes long. It's about a gentleman that took care of his wife for a couple of years following a stroke. And the message that he kind of imparts here is that caregivers have to be selfish to survive, because if they don't survive, the patient isn't going to survive. So it's super important that they have opportunities to attend to their own needs. So if you give me a second here, I'm just going to close this up and we'll open up the internet to take a look at this case study.
So while Karen is setting up her video, I just wanted to comment how shocking that statistic was with the 30% of caregivers pass before the people they're caring for. You know, you always hear the stories of people passing or dying relatively, you know, short months apart or weeks apart. But that is, you know, that's about a third of caregivers. So that's a really high number.
My computer's just a little slow this morning, but it's getting there.
Karen, do you want to put the link in the chat? Maybe I can pull it up for you.
Let me try that. Okay, that's the link there.
Almost everybody out there who can hear my voice is eventually going to care for a parent, a grandparent, or a loved one. Or maybe you're that one that's going to eventually need care. The National Association of Family Caregivers says that 1/3 of the population of the U.S. are already caregivers. Wow. Of those, roughly half of them are feeling down, depressed, and hopeless on a regular basis. That's according to AARP. Many of them will become sicker than the ones they care for, eventually needing a caregiver of their own. Now, the worst part is 30% of these caregivers will actually die before their loved ones do. So says agingcare.com. If you're not a caregiver, just wait. You'll either become one or you'll need one. That's why now is the time to prepare and learn how to become a caregiver, not after tragedy strikes. You see, caregivers need to learn how to become selfish if they want to survive. I know this firsthand. Let me tell you why. My wife Charlene and I had a fairy tale, storybook, romance, courtship, and marriage for the first 21 years of our lives together. We were in love with each other so much, I just knew I had to marry this girl before she got away. We raised our 3 daughters. We got them all out of the house. We even got them married off. All 3 of them twice. I think you're only supposed to pay for the first marriage. We now have 7 grandchildren. And right about the time that my wife and I were supposed to be entering into the empty nest phase of life, where we go wherever we want, whenever we want, don't have to worry about leaving the kids in the house to wreck the place, and we have the freedom and the independence and the finances. One day, my wife complains to me about this bad headache that she had for 3 days. She called it the headache of her life that just wouldn't go away. One day, I realized that actually it was the 4th day. On that 4th day, that headache ceased being only a headache. By the time the ambulance arrived, my wife had suffered a massive stroke, and it left her severely speech impaired and paralyzed on the right side. And in that moment, I was no longer just her husband. I was now her husband and her caregiver. The next 2 years was like a living hell for both of us. I had no idea what I was doing. I made every mistake in the book. Every mistake a caregiver could possibly make. It wasn't on my resume. I didn't even know what a caregiver was. However, I quickly learned that if I didn't become selfish, there was no way I was going to make this thing. I could have ruined my health. I might have even died before my wife would have. I quickly started realizing that I was experiencing the same problems that other caregivers experience. The first one is the guilt. I started feeling guilty all the time, but I quickly realized just because I was feeling guilt didn't mean that I necessarily deserved it. The next big problem that was plaguing me was this feeling that I was always never getting any help. But worse than that, it was because I couldn't even ask for help. I just had it in my mind, if I couldn't do this all by myself, I was a failure as a caregiver. That doesn't look good on a resume. It wasn't long before I started feeling these isolation feelings, like I was all alone in the world. My friends stopped calling, stopped coming by. I don't blame them because I was always negative and complaining when they did. Who wants to be around that? It wasn't long before I just started feeling hopeless and helpless. I remember screaming out, I don't even know who heard me, "I can't take this anymore." I guess I was talking to God. I just went on in my pain because I didn't know what to do. But thank God that somebody invited me to a caregiver support group. I didn't know what that was, but I was desperate, so I went. And everything changed for me. I found people who were just like me, burned out caregivers, I found hope again. I remembered that the airlines tell us in the event of an emergency, put your mask on first before you help your loved one. What an amazing metaphor for all of life. I had to learn that if I didn't become selfish, there was no way I was going to survive this. And if I didn't survive, who was going to take care of Charlene? Let me talk about depression. With all the recent suicides in the news lately, we have to ask this question. If there is depression, is suicide far behind? Anthony Bourdain, Kate Spade, Robin Williams. These celebrities are no longer with us because they succumbed to that suicidal depression that affects caregivers as well. Yet we don't hear about how many caregivers died in the news, just celebrities. Another important reminder why caregivers need to learn to become selfish in order to survive this thing, so that their loved ones can continue to receive their care. Everybody asks me, so how's your wife doing? And I proudly say, well, because I've learned how to become selfish and put my needs first, she's doing great. She's advanced through the grief process, and she has embraced the new normal and reinvented herself and figured out that if she's still alive, God must still have a purpose for her here on this earth. Now, she still can't talk, but she can communicate non-verbally through Pictionary, charades, two games I hate, by the way, but I'm learning to love. She still can't walk, but we bought her a power chair, and she loves it. She gets to go wherever she wants now. That chair has been all over the world with me, and I have trouble keeping up with it. And anyone who meets her for the first time is thoroughly amazed at how she has a smile on her face all the time and joy in her heart. She's my hero. I am so proud of her. She's like a one-armed wallpaper hanger. And I just don't know how she does it. But because of Charlene, I can now help other caregivers stay alive and stay healthy. I want you to imagine for a moment what the world could look like if every new caregiver was already capable, ready, and healthy, and was easily able to maintain those qualities for as long as they cared for their loved one. If every caregiver can learn to become selfish in order to survive, and if they can really do that, they will become stronger, healthier, and happier, not only in their caregiving responsibilities, but in everything that they strive for in life. I'm living proof. Accent on the living part. Honestly, I promise you, you will not only survive this thing called caregiving, you will thrive, you will be joyful, and you will be the best giver of care to your loved one. I guarantee it. Just remember whose mask goes on first. Thank you very much.
Trying to put the, I have, we have a couple of questions here that might get us started with the idea of question and answers.
I can actually, if you'd like, I can put them up, Dr. Delonzo, if that makes it easier for you.
Yeah.
Yeah.
Thank you.
No problem. Actually,
So I
before we do this,
close the PowerPoint, trying to open it up again is.
no problem. Even before we do that, would you like to do the post test for our poll
Sure.
questions? We can do
Sure.
that. And then if you want to talk through those a little, and then we can do our answer, in an answer form as well. So Evelyn, if you could please put up the poll for us, that'd be wonderful.
Okay, so as a teacher, I very nicely gave you hints on all three of these in the course of the presentation. The first one is caregiving has both physical and emotional components. Caregiving is only a short-term responsibility, true or false? And caregiver burnout can sometimes result in behavioral issues or substance abuse, true or false? Okay. So you can definitely see that there are physical and emotional components involved in caregiving, and sometimes the emotional ones are even more difficult to deal with than physical ones. You know, you don't know that you're getting a curveball thrown at you when you come downstairs in the morning, you know, for example, and all of a sudden the person may be thinking about something or wanting to do something that they haven't shared with you, and all of a sudden there's, you know, there's a conflict about how we're going to do this. So the emotional issues are very difficult. I know, although this presentation has really focused mostly on cancer, but we certainly have people that have comorbidities. My daughter has a friend of hers whose mother has Parkinson's disease, and she has been diagnosed with the psychosis that often accompanies Parkinson's disease. So this woman is having all kinds of hallucinations and delusions. And, you know, I had lunch with her daughter a couple of weeks ago, and she just said to me, and you know, 3 years ago, if you could have ever told me my mother would be in this situation, I never would have believed it. And it's just super hard. The woman takes off at night, works her way out of bed, down the stairs, out the front door, walking around in the neighborhood with no clothes on. Husband can't handle it anymore. You know, there's a whole host of things that you can think about that can become huge challenges. And sometimes they could be cancer themselves. They may be cancer and another disease, you know, coupled with it. Caregiving is only a short-term responsibility. Maybe, but maybe not either. You know, this could be a much longer responsibility, and we really don't know, in many cases, how long someone has to live, you know. Caregiver burnout can sometimes result in behavioral issues or substance abuse. Yeah. And as I mentioned, particularly if the person had a history of, you know, alcohol or substance abuse before, you know, when they're in a situation where they're really stressed, and they have access to narcotics, perhaps the ones that the patient isn't using, or old prescriptions or whatever, or other kinds of psychotropic drugs, that can be a real problem. So there's your answers there: true, false, and true. Okay.
Wonderful. Thank you, Dr. Jones, for going over those questions. I guess this would be a great time now to go into some question and answer forums. We did have a lot actually of comments just in the chat. It's you know, it's crazy how this issue is something that affects everybody, I feel like, and maybe at some point in their lifetime. And I know somebody else, I think it was Lenore, that also brought up a good point that it's something you don't necessarily think of it in this way, but something that happens with postpartum depression and things also with mothers. So
Yeah.
who have newborns. And so that was actually something that I was going to ask about as well, with beginning of life and the end of life, are they very similar in that sense with the
Yeah.
caregiving as well?
Yeah, and the whole area of postpartum depression is really an interesting one, because we know more about this than we used to know. There was a drug that was just approved not too long ago as a hormonal treatment for PPD. And in the past, usually they would put people on antidepressants, but the idea behind this approach is that a lot of this is caused by hormonal upheavals that occur in that postpartum period. So that might be a possibility as a good treatment. The other thing we're starting to see is more studies that talk about men who have postpartum depression, which is really interesting because that hormonal issue doesn't exist for them. But this happens to men who are married to women that are also going through postpartum depression, and it happens to same-sex couples that adopt a child, all kinds of stuff here. 1 out of 7 or even 1 out of 10 men experience postpartum depression or anxiety. Yeah. So, this is something else that we need to think about. Fortunately, many men now have access to paternity leave when their wife delivers, which is probably a really good thing, not just for the wife, but for the husband as well, or the partner, to try, and just kind of get a handle on like what their role is. As that man said in the TED Talk, he wasn't prepared for this. And lots of people aren't really prepared for when they have a baby. They may think they are, but and they may have the stroller and all that kind of stuff, but in terms of emotionally prepared for it, maybe not. So those are important issues. Yeah, definitely.
Yeah,
So
thank you.
We asked about getting paid for taking care of my grandmother, and I mentioned that there are mechanisms now that you can receive payment for doing some of these things. So, if you go back and look at that link, that's one of them. There are also other insurance companies that will pay for this. One of the things that I think that's really important that I say to people, what are the most helpful things that you can say to caregivers when you meet them? And probably the most helpful thing that you can say is you are doing a good job. Because even if they're not doing the kind of job that you would like at that particular moment, they are doing the best they can. In all likelihood, they're doing the best that they can. And sometimes this is super important to convey that to people, because the last thing they want to do is to have someone come in and tell them that whatever they're doing is wrong, and so this is an important thing, and it's usually a comment that will get a dialogue started between you and the caregiver as to how are things going. Are there things that you could use some help with? Those kinds of things.
Yeah, thank you, Dr. Alonso. I think just based on the comments, you have a lot coming in as well. Sarah did say thank you so much for this information and your passion for the topic. It is much appreciated. And I know she did post also as well about some organizations in their regions that also are available. She also talked about they actually have it's called the Peaceful Presence Project Oregon, and they have a death doula training and to establish, care and things like that for serious illness. So I thought that was actually very interesting for hospice or palliative care as well. just to kind of give that support to caregivers. But let's see, I don't know if there's any other questions. If anybody has any other questions that weren't posted in the chat, feel free to raise your hand, or you can absolutely unmute yourself as well if you have any questions for Dr. Delonzo. I am keeping an eye on time. We are at 11 o'clock, and we do usually run till about 11:30 if we do need the time. But I'm just going to give it another minute or two. So if anybody has any questions, and if not, I can go through the rest of our presentation for today. So I will continue all of our sessions. I did see a question about the sessions. They will be posted on our Mighty Networks in about 2 weeks. So just get time to go through and to make edits. But Dr. Delonzo, thank you so much for the presentation for today. It was extremely informative. And I think it was a topic that needs to be discussed more about and more research needs to go into, because, this is something that, I think everybody faces or has some kind of experience with in their lifetime. And so just to be respectful of everybody's time, I'll just continue with a few announcements and then we will wrap up. And so in our state, we do have New Jersey SEED, or the New Jersey Cancer Education and Early Detection Program. And it's a program run by the New Jersey Department of Health in collaboration with local agencies and healthcare systems. And the NJC program provides education and outreach within the community about different types of cancers. They provide free screenings to those that are unemployed, underinsured, uninsured, or face barriers to getting the cancer screenings that they need. And the NJC program currently provides screenings for breast, prostate, cervical, and colorectal cancers, and it is offered in all 21 counties throughout the state. So if you need any more information, please feel free to reach out to us or even visit their website. And so again, thank you for attending today's session. We would be very appreciative if you could use the link or even the QR code on your screen to let us know how we did, or if there are any topics that you are interested in seeing in the future. I believe it will also be dropped in the chat as well. And the materials and resources, I know that's a question that comes up often, will be available on our Mighty Networks community. That link will also be dropped in the chat. So if you need to register or to sign up, just give us about 2 weeks or so for our recording and resource finalization, and then everything will be posted on there. And coming up, we actually do not have a session in August. Everyone, please enjoy your summer. We will see you all in September. So if you have any questions or any concerns, please feel free to reach out to us in the meantime. But if not, we will see you all in September. Thank you, everyone.
Thank you.